Hello, listeners. This is Yukta speaking, your host for today's episode, which is the talk given by Dr. Rathi Balachandran on the topic Nursing Practice Trends and Innovation. This talk is a part of the first virtual IC Nursing meeting hosted on the topic Serving on Organizational Boards What Nurses Need to Know. Let us hear from Dr. Rathi Balachandran.
Very good afternoon, one and all. Respected dignitaries, Vice Admiral Dr. Dr. Geeta, the panelist of the day, and the dear participants. I appreciate the organizers for selecting such an important topic and having the panel discussion on innovation in nursing. I congratulate all the nurses in the year of nursing 2022 and also for the decade of nursing and midwifery, based upon the fact that if the effective contribution of nurses and midwives are important for sustainable development goal and universal health coverage. Today, I'm happy to be with you to discuss on the topic of serving on organizational boards, what nurses needs to know. Let me start the discussion with quoting Dr. Tedros, that nurses and midwives are not only essential for delivering the health services, their experience and knowledge are also valuable assets in shaping health policy, and their voices deserve to be heard at the policy making table. This was his quote during 2018 February, when the Nursing Now campaign has been launched. The countries around the world face huge challenges in providing healthcare to their people because of the scarce resources and the rising burden of chronic disease like diabetes and the impact of emerging factors such as climate change and migration. And now the global pandemic and healthcare cost further highlights the need for nurses to be at the decision-making levels. Nurses and midwives play a central role in all health system, and we support people in every aspects of their health and well-being, from health promotion to chronic disease management and specialist services. Together, we make up the half of the professional health workforce globally and also account for about 90% of the contact between the patients and health professionals. And the countries, it's also evident that the countries that invest in and develop their nurse and midwifery workforce can achieve a rapid, cost-effective expansion of high-quality universal health coverage. Already the nurses are effective leaders in various healthcare organizations, and more than 10,000 nurses are on board in America. Nurses are professionally prepared to offer a substantial contribution at the board level, and they possess wide range of skills gained from the experiences that are transferable to the board duties. That is, in their daily activities, they are accustomed to balance interest and power of stakeholders, multidisciplinary communications, the connections beyond one's employment position as advocates for the people, and understanding during her daily practices, they are understanding the complex clinical situations, the unique relationship between the patients and family, and the ethical practice, moral values, as well as disciplines. These skills they gain as a part of their daily experience can be transferable to contribute effectively as a board member. Based upon the scientific studies, it is seen that the professional commitment is the most important to be taken care by the board members, that they are representing healthcare team. The board meetings have to be taken as seriously, understand the purpose of it, what is the structure of that, and how it functions, and legal and ethical process of conducting meetings, etc. It's entirely different from direct patient care in the hospital as well as policy. But it's also important to develop these skills. So the second thing is about the communication, the productive communications So how to express the ideas and convince other members by listening, reflecting, clarifying, and validating others' view and networking. At the same time, the managerial skills like conceptual skills, critical thinking and strategic planning, etc., to lead effective and efficient board meetings and managing conflicts is also important to function as a board member. What I really wanted to say is that we have to understand the fact that we are a part of a larger group. Our activities contribute towards the common goal of human and social welfare. So hence, it's responsibility of nurses as well as the opportunity for the nurses to participate in policy making. But are we effectively contributing or not? Yes, in few developed countries, they recognize the importance of nursing, as I mentioned, the skills or competencies that develop as a part of their education as well as experience are being utilized for making better policies. But in our country, it is still underutilized. There are certain strategies which are there to develop these competencies. To say few, the meaningful interprofessional education and interdisciplinary mentorship, the facilitation of skill development and recognition of opportunities to serve, integration of financial and policy topics into the undergraduate and graduate level of curriculum, and support opportunities to develop the financial and policy skills. We as the nursing professionals have the responsibility to support the budding nurses as well as young professionals to participate in decision making right from the bedside to the unit level and departments, as well as at the organizational level, by involving them in various committees. And through this exercise, people can develop this skill of contributing effectively in the board meetings. For these things, there are certain global initiatives also. We all know that the year 2020 was considered as a year of nursing and midwifery to communicate the significance of this profession for achieving universal health coverage and sustainable development, for which the Nursing Now campaign was initiated in February 2018. And I also quoted the DG Tedros at the time of launch, in which it was requesting all the policymakers to invest more in nurses and improving their competency and giving them opportunity to utilize their education and training to the fullest to meet the healthcare needs of the world. Following which, in July 2019, Nightingale Challenge was initiated, where the request was made to at least all across the world, 1,000 employers were requested. We have to identify the 1,000 employers who will invest at least 20 nurses below the age of 35 to develop their leadership and managerial skills by mentoring or giving them opportunity in multidisciplinary trainings so that they will be able to lead nursing profession as well as the healthcare team. And for anything, it is also important to have data, for which the State of Nursing Report 2019 was the first effort to collect data about nursing across the world. And the second State of Midwifery report was developed in 2020. The Nursing Now Challenge, after completing 3 years of Nursing Now campaign and 1 year of Nightingale Challenge, the Nursing Now campaign and Nightingale Challenge has converted into Nursing Now Challenge in June 2021 with an objective of championing leadership development opportunities for 1 lakh nurses and midwives in more than 150 countries, with which there are opportunities provided to various countries by the WHO and other developed countries to contribute and invest in nurses in their country. And finally, there is a strategic directions for nursing and midwifery. That is the strategic direction of nursing and midwifery, May 2021, under which there are 4 key areas which is there. It is education. The midwife or the nurse graduates match or surpass the health system demand and have the requisite knowledge, competencies, and attitudes to meet the national health priorities. The second area is job. This increase the availability of health workers by sustainable creating nursing and midwifery jobs and effectively recruiting and retaining midwives and nurses and ethically managing international mobility and migration. And the third key area is leadership, to increase the proportion and authority of midwives and nurses in senior health and academic positions and continuously develop next generation of nursing and midwifery leaders. And the final one is service delivery, where the midwives and nurse workers work to the fullest extent of their education and training in a safe and supportive service delivery environment. These are the platforms which are provided for the nurses with the support of nursing agencies and organizations all across the world. And the India being a member country of WHO, we are also following in the same line. As I mentioned, we have to consider that we have to work, think globally and act locally, and understand that we are the part of a larger system, and the small and efforts which are done at locally will have an impact. And now we all can understand that health is not a state not limited to the state or an individual or an organization. A health issue or a problem in any part of the world is a challenge to other part also. And this pandemic has proved it all the more that the challenges have been increased. Hence, my request to all my fellow colleagues are think globally and act locally, contribute in smaller steps so that develop nurse leadership in the nurses at every level and give them an atmosphere to involve in decision making. Right now, I am in a multidisciplinary mentorship. These are certain efforts doing by the government, recognizing the importance of nurses and their key competencies required for meeting health needs and universal health coverage. We all are aware about the initiatives under Ayushman Bharat, where nurses are utilized as community health officers who participates in Rogi Kalyan Samitis and give their together, they take decisions which is best for the people of that health and wellness area. And we also have midwife-led units where they give key inputs for the management of the labor rooms as well as the maternal and child health units. So the environment is there. Now the opportunities what we have to utilize, and so it is both a responsibility as well as opportunity for nurses to contribute effectively in the team, in the board, for taking correct policy decisions for the healthcare delivery. Thank you once again for having me among you, and wish you a great success for this webinar and a great learning for all the participants.
Thank you, Dr. Rathi Balachandran. To watch the complete club meeting on this topic, visit the link in the description below. Subscribe to the channel to get instant access to all the podcasts. Follow us on social media through the links available in the description below. Thank you all for spending your time in listening to this week's podcast. Look out for a new episode every Wednesday published on Google Podcast, Spotify and Apple Podcast. If you're interested in hosting your podcast with us, fill the form available in the description below. Thank you once again. See you next time.